Okay, well here we are in the therapy room at my office here in Daytona Beach. My friend Bill is helping me with this part of the demonstration. And here we're talking about the rotator cuff muscles. So remember, you have infraspinatus, supraspinatus, teres major, and subscapularis. And I have a scapula here and have his left shoulder, and consider having your person side lying on the table. A lot of times we work on people supine and prone and don't realize that we can lay them on their side. Just support their head so that their neck is and their head is in line with their sternum and with their backbone, and that way you're not putting any stress on their neck. And what it does for the shoulder is, because of gravitational force, it actually pulls his left shoulder towards the table, and it slackens his upper trap, because the upper trap sits right over the supraspinatus muscle. And we're talking about the spine of the scapula. A spine, remember, is a prominent bony ridge. So you have a spine of the scapula, you have a vertebral spine, and a spine of your iliac crest. And so you have supraspine, which is on top of, infraspine, which is below in this big opening, this fossa here. And you can see that the depression in the bone is a pretty good size. So that's a pretty thick area of infraspinatus. Teres minor comes from the lateral upper 1/3 of the vertebral border, or no, the lateral border of the scapula, and attaches to the humerus. And then subscapularis is the mirror image of infraspinatus. What is on this back side, just flip it over, and even the fiber arrangements are the same. So you have subscapularis. Does that make sense to you? Underneath the scapula. So as this sits, his inferior angle is here. So line up your landmarks. Find the spine of his scapula. It is right here. You can easily feel the bone. So you know supraspinatus is in this depression, just like you're looking at here. Infraspinatus, find the spine of the scap, find his inferior angle, find the vertebral border, and you can even find the lateral border if you want to, which is there. And so you know that infraspinatus is this targeted area, and then you know teres minor is this piece up here. And do you have to exactly know where everything is? Actually, no. You have fingers, don't you? You can feel thick, dense areas. You know that what you're looking for is a contraction, not in the muscle. So you don't have to actually have exact places. Don't get so narrowed down to a spot, because things aren't spots. These are regions that you have a starting point. That's all it's about. And so when you're looking for a trigger point, which you know is manifested by the contraction knot, you're looking for a thick, dense area and something that's going to hurt these people when you press on it. So what we're going to do here, find the spine of the scapula and know that supraspinatus is in this depression, and push your pressure into that area. Go back and forth, go side to side, search for something that's thick, search for a ropey strand. Watch the face of the people who are on the table, and watch for any wincing or any squinting or something that might indicate to you that you found something significant. This actually hurts more than everything else. Then you could put some lotion on this. I'm not going to actually do it, but do some stroking down through the muscle. Do 4 or 5, 6 strokes and get off. Go away. Go to another muscle. Then go to infraspinatus. Don't get on one muscle and just beat it, beat it, beat it, beat it. Get onto something, give it a few strokes, especially if it's uncomfortable, and get off. Know that was in your chart, remember what I showed you earlier in the pain pattern drawings. There were 2 spots that were injected, and it showed what the pain patterns were. There's also a common trigger that'll form way out on this lateral edge as the supraspinatus tendon exits the acromion process. There's a place right on top of the humerus where you can also get a spot. And so go search all around there. Use your fingers, search back and forth. You're not going to feel the nodule if it's on a tendon, but boy, it'll be a damn sharp spot, and these people will know it's there. And if you need to hold pressure to it to calm it down, then do that. Go through your infraspinatus, go back to supraspinatus. You can add in teres minor, give everything a couple of strokes, and go away. Get off of everything for a little bit. Make this round and round, round and round. One muscle, then the next one, back to this one, back to that one. And that's how I work on this kind of thing. So go through the muscle, and if you find nothing there, okay, so you found nothing there. Not everybody has a spot in supraspinatus that's causing them a problem if they've got a rotator issue. Maybe it's something else. Maybe it was in infraspinatus. Maybe it's in subscapularis. Maybe it's not a rotator cuff at all, but that's where you start, because if the joint is not stabilized, the prime movers are going to exhibit weakness when you try to raise the arm. Now, once you have softened that, remember that the neutral position, when you are standing, the neutral position for the arm is usually considered kind of the full length for supraspinatus. But you want to get a little additional length. If you've worked on the muscle and you say you want to stretch it, you want to elongate it, then take the arm behind the body and let it hang down a little bit, because now what this has done is taken that muscle and it takes advantage of as much as you can. I mean, it's not going to move all that much anyway. So this is a very small muscle that matches teres minor. Teres minor is actually, this is the north, teres minor is the south. We're talking subscapularis infraspinatus as east and west. So when I described the joint to you previously as north, south, east, west, now you have the components. The teres minor and subscapularis are about equal in size and equal in strength. They do not equal the strength of the other two, because those are always stronger. The infraspinatus and subscapularis are a matching pair, and they are bigger muscles and they exhibit more power and strength. So this is how you work on this one, and we'll be back with another video here, and I'll show you teres minor.